Welcome to the first session of our Justice Diversion Learning Collaborative. As I mentioned, I am co-presenting today with Ande and Danny, and we all three of us work in the CARE TA Center. Ande is with CARS, the Center for Applied Research Solutions, and Danny is with Impact Justice. So we are funded through the California Department of Healthcare Services, Mental Health Services Act, and we receive logistical support from CARS, the Center for Applied Research Solutions. What we're about to share here today does not necessarily represent the opinions of anyone but ourselves, though we are very grateful, of course, for the funding and the support that we receive from these organizations. We do not anticipate any challenges, but were there to be any security issues, we ask you to rest assured that we are working on it in the background to ensure that this is as safe and good of a learning environment as possible. Were we not able to manage something in the background, we would go ahead and close this Zoom room and then send you an email with a new Zoom room to log into. So if you're new to the CARE TA Center, we are the Crisis and Recovery Enhancement TA Center. As I mentioned, we are funded through MHSA and the Mental Health Services Act. We provide training and technical assistance to the 58 MHSA funded county behavioral health departments in 2 city jurisdictions in the state of California to provide training and technical assistance regarding crisis care continuum and justice diversion. We are in the second year of 3-year funding, and we are honored to be a collaborative that works with several big name organizations who you might know on a local level in California and on a national level. I mentioned CARS. We also work with Recovery International, the National Alliance of Mental Illness California chapter, C4 Innovations, Research and Action Center at Impact Justice, and Stanford Sierra Youth and Families. And as mentioned, Dr. Soto, it works with Impact Justice, which is that Research and Action Center. We provide a variety of different types of TA training and technical assistance. In addition to webinars like this, we have learning collaboratives, which cover a variety of additional topics, but we also do 90-minute webinars. We have a newsletter, an annual conference that'll be coming up at the end of this spring. And we have tools on our website, such as an asset map, where you can go and look at the various justice diversion and crisis care services that are local in your county. We do encourage you to get signed up on our newsletter so you can stay informed about all of the new resources that we're putting out into the field and where you can ask for TA. Please do let us know if there's something that we can do for your individual program. We'd love doing intensive TA trainings, and consultation is available through our website. So as I mentioned, we are in the first session of a 4-session series on justice diversion. The learning collaboratives are designed to build on progressive knowledge over 4 meetings with executive leadership and top leadership in both behavioral health and justice systems. Today, we're focusing on a state of affairs. So we're going to be looking at the sequential intercept model as a framework for engaging in strategic planning and to identify gaps and strengths across systems that relate to justice diversion programs. Again, bringing together both the justice diversion side from justice systems as well as the behavioral health workforce sides, focusing on communication pathways, as well as different points in time when we can divert people from the justice system who are experiencing behavioral health crises in the community. As you can see, our objectives for today are to identify key resources. I'm really excited. Ande is going to be sharing with you a variety of no-cost, available 24/7 resources that are in written form as well as visual webinars available to you and your staff at any time. You might have also seen in our reminder email that there is a no-cost training coming up for sequential intercept mapping through SAMHSA. Ordinarily costs about $24,000, but you can apply to receive this training for no cost. We're going to be sharing additional resources like that, but importantly, you will have an opportunity to share stories about the strengths and challenges, best practices, workarounds that you're experiencing in your county, and hear from other counties toward the end of this event. So without further ado, I'm really excited to share with you just a little bit of information about my amazing colleagues who are going to be presenting today. Dr. Danny Soto has more than a decade of experience in research and analysis of adolescent well-being and risk, with a focus on gendered and racial ethnic inequalities and juvenile delinquency. Danny spent 4 years as an assistant professor and now uses her professional skills in research and analysis in an applied way within the nonprofit arena. Recognizing that true justice requires attention paid to the intersections of race, ethnicity, sexuality and sexual identity, sex and gender expression, and socioeconomic status, she frequently examines disparities in these areas. Ande Pena spent over 10 years as a director in community-based diversion and reentry programs, serving youth and young adults on probation and parole. Before joining CARS in September, she served as the treatment court manager for the Superior Court of California in Alameda County, supervising 8 treatment specialists in the Office of Collaborative Court Services. And briefly, myself, I'm the director of the CARE TA Center. I am a social worker by profession and have spent some time in the California Corrections Facility down in Santa Clara County, looking mostly at HIV and Hep C prevention. So it's exciting for me to be focusing in this area on behavioral health crisis care. And in a moment, I'm about to hand this over to Ande, but I just want to briefly look at our learning objectives today. So as I shared, we're going to be looking at the SIM, sequential intercept model, and talking about it as a framework that you can use for strategic planning. Then we're going to talk about identifying those key resources that you can use at no cost. They're available anytime online for you. Finally, we're going to have some opportunity to have peer learning, where we will turn on the microphones and invite you to answer more Zoom polling questions and communicate in the chat box as well to talk about the challenges and assets of justice diversion programs at your local county level. And then finally, we're going to conclude with a homework assignment. If that makes you nervous, don't worry, it's actually going to be great. And we have office hours available should you want some extra support after this event is over. And we will talk about that homework assignment at the very end here. So without further ado, I'm excited to hand the virtual mic over to Ande, who will get us into the real meat and potatoes of this.
I would like to take a moment to highlight areas that are doing great work in our state. So what you see here, if you can identify your county on this slide, I would like to say congratulations and thank you, because you are one of the counties that has taken the step to move towards what's called the Stepping Up Initiative. And out of the state of California, 37 counties have been have made the agreement to step forward into this initiative. So the Stepping Up Initiative is a partnership between the National Association of Counties, the Justice Center of the Council of State Governments, and the American Association Foundation. The initiative is focused on collecting necessary data per county to guide systemic changes specifically for diverting people with mental health concerns from jails into treatment and services. The work is accomplished through focusing on 4 key outcome measures. So if you see your county listed here, just know that there's work being done looking at these 4 areas, and we'll talk about this more in future sessions. The first data point that they're really focusing on is the number of people with serious mental illness that are booked into our jails. The next is the length of time that people with SMI are remaining in jail. The third is the connection to treatments that are being made for those individuals. And the last is the rate of recidivism that those individuals are experiencing. So this is a slide that's available, and there's information available on the Stepping Up Initiative Together website. That's the link there that you would be looking for if you wanted to learn more about the initiative in your community. What we've done on our next slide is we have brought forward 4 stories that highlight the work that's being done, particularly in the state of California, because this is a national initiative. So what you see here are 4 stories that they have listed on their website that display how these counties are integrating the Stepping Up Initiative throughout their community. So we just wanted to take a moment to say congratulations and thank you to the people who are doing this work. There was 37 of you listed on the last slide. There are 4 that are being highlighted here. So there's really good work that's being done in our communities. And we, like I said, we will be talking about this more in a future session when we get more into data. And I'm going to hand this over now to Dr. Soto, who is going to be doing an overview of the sequential intercept model and the map. So Dr. Soto, thank you.
All right. Thank you, Ande. Thank you, Eliana. Thank you to everyone joining us today. Thank you for your time and for your participation. What we're going to look at here is one way of looking at the sequential intercept model. Here it's presented in a kind of a linear way, with each of these intercepts representing a deeper step into the criminal justice system. Right. So one thing to point out here is that even though the arrows go, directly lead to a deeper intercept, what justice diversion is really focused on is the opportunities to divert people away from the justice system at each step. Right. So something to keep in mind. You'll see that the first little band there is community. And so Intercept 0 refers to those services and resources and programs that are embedded in the community and provide services in the community setting. So there might be partnerships or MOUs or agreements with system partners, but the justice system itself is not part of providing these resources. So examples here would be alternative crisis lines, alternatives to 911 that don't involve law enforcement, that provide, other crisis response teams. And those services that respond to crises and connect people to the services that they need within the community without involving the justice system. The next intercept would be the one that is often the first touch of the justice system is law enforcement. So this is often begins with 911, but not always. There are multiple ways to engage, law enforcement. There are multiple situations where law enforcement might respond, and so So Intercept 1 would involve partnerships with police and with law enforcement. And of course, the opportunity here is to do a pre-arrest diversion, right? Where maybe there's been some police contact, but with MOUs or alternative resources in place, law enforcement, have alternatives rather than proceeding to the next intercept, which would be some kind of jail booking or initial detention or, further system contact. So Intercept 2 here. So this looks like jail bookings. It looks like initial court hearings, initial detention, and these include services that are provided in jails. As many of you, I'm sure, are more familiar with than I am, I'm on the more justice system side. After deinstitutionalization in the 70s, unfortunately, there wasn't a reinvestment of those resources into community. And so now county jails are the largest providers of mental health care in the state of California, right? And California is not unique in that. So here we see a lot of jail-based services and court-ordered services that are intended to prevent the worsening of someone's mental illness or circumstances. Intercept 3 further involves jails and courts. Sorry, I misspoke. The court-ordered services would occur at Intercept 3, not at Intercept 2. Sometimes there might be a diversion away from a criminal court to a specialty court at this stage that is focused on substance use, mental health, behavioral health issues. And so those might have separate services or separate programs affiliated with those courts as well. So Intercept 3 is where we would see incarceration post-charge, right? It's not pre-trial hold or a pre-trial detention. This would be as part of their sentence or disposition, or whatever language is used by that court. And so then obviously after having been incarcerated, if folks have been funneled into the system that deep, the next intercept is reentry. Whether this is from a prison or a jail, in some cases, there might be court-ordered residential rehabilitation facilities or things like that. So this reentry piece is especially critical because depending on the length of time that someone has been incarcerated, disrupts familial connections, can disrupt employment, can interfere with housing, can even result in loss of custody of children. There are a lot of collateral consequences to incarceration that then at this intercept 4 makes this intercept particularly critical, right? People are especially vulnerable at this stage, not only in terms of their own mental health or behavioral health recovery, but also because all of these added stressors of reentry are also kind of layered on there. So this is an especially vulnerable place, but one that also is really essential, right? To make sure that there's continuity of care, continuity of services, access to, services, supports, medications, all of those things are really critical here. And then intercept 5. Intercept 5 is similar to intercept 0, and you'll see we have another kind of visual representation that kind of highlights that overlap. Intercept 5 also includes community-based services and programs and supports, but they are still happening under the corrections umbrella because they are wrapped up into conditions of probation and conditions of parole. So there might still be, in order to meet the conditions of your parole, there's still, court-ordered or required program participation. You might have to submit to drug testing, random drug testing, things like that during this period. But then you'll see at the bottom there is another band that says community, right? People don't stay on parole or probation forever. That can be a long, difficult process for sure. I'm not trying to minimize that, but eventually those, the participation the required participation will end, and that kind of thing. And so Intercept 5, again, these are community-based services, but they're court ordered. They're part of a requirement. One thing to note here, and here we have a note off to the side, because it obviously wasn't part of this this graphic here, is to note that non-citizens, whether they are documented or undocumented, are often diverted away from the criminal justice system, away from behavioral and mental health systems, because any quote unquote crime that's committed or law that's broken or any justice system contact can trigger immigration system involvement, right? So deportation proceedings, there are different detention facilities and things like that. And that is not represented in this model. And so for those of you who might be working or thinking about Intercept 0 community services, this is an especially crucial phase for immigrants, particularly those who are undocumented or who are non-citizens, because if we can divert them into services that will help support them without that justice system contact, that bodes well for them, much better for them than if they have that justice system contact. Okay. Just one other note, just be thinking about, I think Eliana and Ande both kind of mentioned the homework. We'll talk about that more in detail towards the end of the presentation, but keep in your mind, the landscape of your particular county and the services and programs that exist, and be thinking about where they would fall along these intercepts. That will be a part of your homework, but also just, things to keep in the back of your mind as we're going through our presentation. And so this is just another visual representation of the SIM model, right? And again, these arrows point to pieces that are deeper or steps that are deeper within the criminal justice system. And so you'll see here that instead of it being, community is both the top and the bottom band of a linear kind of representation, right here it is, they meet, right? They meet in the middle. And so one thing to really notice here that's particularly important is that community services and support, whether it is post re-entry or whether it is, someone who has never had system contact before, this piece, the community embedded services are particularly important because they represent one of the best opportunities that we have for justice diversion and for providing people with the resources they need in the best possible environment. Obviously, the programs and services that we're providing at all of the intercepts, right? We want them to be effective. We want them to be, center the humanity of people who are involved. But we know from, decades of, and well, really hundreds of years of research on the criminal justice system, we know that justice system involvement causes harm to people. We know that that's not the ideal environment for providing mental health, behavioral health, substance use treatment. Those services are best provided in the community. So that's not to forget about everyone else who's in the system or those who might be funneled deeper in. But what we really want to emphasize here is community services and support often gives us the biggest bang for the buck, so to speak, in terms of really getting at people and either preventing, worsening of mental illness and needs, or preventing another cycle, right? Even our focus on recidivism speaks to the revolving door that often exists in the criminal justice system, right? That reentry is insanely difficult and often results in, just further system involvement. So that this is a great time to interrupt and try to prevent future system contact. Another thing that I like about this diagram as well is that each of these intercepts are presented in a wheel, but at the center are those best clinical practices. So this really points us to the importance of centering evidence-based practices, which we're going to talk about more in a future session, but also prompts us to be responsive to advances in the field, right? What we know now is as good as we know now, but I know that by this time next year or 5 years down the road, we will know better, we will know more, and we will know even better practices and things like that. So just a reminder that we should be centering those best practices, promising practices should really be at the center of all of these efforts. So the point, I guess, of the SIM model and the SIM exercise, and again, this is not a whole separate workshop exists to walk people through the SIM process. We're really, really, really high level, just kind of, hitting the high points here. It's not only a way to kind of map out resources, programs, and services within counties. It is also a way, it's also a tool that can help us identify where gaps are, identify where communication, warm handoffs, that kind of thing, interdepartmental, interorganizational relationships might need to be strengthened, with the ultimate goals of preventing initial involvement in the criminal justice system altogether. Again, if we can avoid system contact, research shows that system contact in and of itself increases recidivism. System contact predicts future system contact, unfortunately. And so again, if we can prevent that initial involvement, that is much better. And the flip side of that, of course, is to decrease admissions to jail, be able to support people in their communities without disrupting their relationships, employment, those kind of things is really important. Obviously, we want to engage individuals in treatment as soon as possible. So looking at those intercepts, right, and looking at what populations are coming into contact with our programs and our staff and line workers, where are they coming into contact? We want to minimize the time spent in the criminal justice system. Obviously, some of this is up to, another decision maker, the court, the judge, law enforcement, whether or not they choose to make an arrest or book. But it's something for us to keep in mind as we're having conversations with our justice partners, with our CBO partners and things like that. How can we minimize the time spent in the justice system? Especially important, again, getting at that reentry piece, is to link individuals to community treatment upon release from incarceration. It's really, really important that folks have that continued support throughout their transition back and reintegration back into their communities. And then, of course, the ultimate goal, or one of our ultimate goals, should be to decrease the rate of return to the criminal justice system. And something we'll be talking about more when we get to the data session that Eliana was talking about earlier, is that, this doesn't need to be, and probably shouldn't be, our only measure of success here, but it is the measure that is most commonly looked at across justice system partners, right? Recidivism has a standard definition and is easy to look at, but we'll be pushing up against that a little bit as we go on. So we brought back up the graphic just to jog our memories as we're going through. We did want to just kind of highlight the types of programs that are often seen at these different intercepts. And you'll see that, intercepts 1 and 2, intercepts 1 through 3, programs often exist across intercepts, right? They might have multiple referral sources. They might be targeting different populations of folks to be serving. So, the messiness is okay. Things don't have to be clear cut or siloed, right? We definitely don't want silos. So at Intercept 0, this again is where we're going to see alternative crisis lines to 911. We might see mobile crisis units. And we might see alternative linkages, right, where 911 links people to people who can help in times of an emergency, right, to grossly simplify that, other alternative forms of linking without involving the justice system. Intercepts 1 and 2, this can look like crisis intervention teams that work in partnerships, in partnership with law enforcement, and includes what we refer to as the Memphis model, and is something that we will be diving a little bit more into in a future session. Similarly, across Intercepts 1 and 3, we see, again, crisis intervention teams, but this is the Miami model, so slightly different than the Memphis model. It crosses more intercepts, and again, we'll be diving a little deeper into the nuances of those. And then Intercepts 4 and 5. So this is reentry and community corrections. This is where we see AOT, mental health courts, assertive community treatment, intensive case management, again, really providing those heavier supports that are often needed after having been incarcerated or having deep justice system contact. And I think we are ready for the next slide. Here we're going to just watch a very short video. This is a video of from two different individuals from 2 different counties who went through a SIM process in their county, and they just kind of reflect on their experiences and share their experiences. So I will, I think Ayana is going to be guiding us through the video.
And while you do that, I so appreciate, Danny, that you've walked us through the SIM model. The idea here is that if you might find this level of systems thinking helpful, this is just kind of the intro to give you the taster of what this model can offer. And here's some feedback from counties, the impact of it on them.
My name is Abby Stamp. I'm the Executive Director of the Multnomah County Local Public Safety Coordinating Council.
My name is Tiffany Hanacho from Buncombe County, North Carolina. In partnership with PRI, we completed our sequential intercept mapping model.
We engaged in a sequential intercept mapping in about 2010, which was prior to me coming onto this position. What is interesting about that is the longevity that the results of the ability to talk about the system in a sequential way has had.
This gave us an opportunity as a community to talk about how we can effectively divert people out of the criminal justice system and into behavioral health treatment.
The focus on our SIM 8 years ago was very focused on mental health. And at that time, there was a discussion around forensic diversion and how to do better intervention with folks at the front end of the system. But what has really held on through our work with the MacArthur Foundation is, as we move forward just into system reform generally, is the ability to look at the system from a macro perspective and identify the similarities and differences between the emergency system and contact with law enforcement, all the way through to the tail end on reentry, probation, and all of the post-prison work as well.
Since that time, we've been able to cultivate community relationships, prioritize some needs in our community, and use the momentum behind the sequential intercept mapping model to apply for the MacArthur Foundation Implementation Award.
I think it helps me when I facilitate conversations about system reform, system improvements, or really system efficiencies to use the decision point sequential intercept model as a map and to help us walk through the system.
We've also used that opportunity to increase momentum around Intercept Zero community services. We coordinate with our local hospital, our urgent care crisis center, and our criminal justice system, including the jail and the courts, to strengthen relationships about how we engage individuals at times of crisis.
We are doing a lot of work, and I know many jurisdictions are experiencing the same type of, I'll just call it initiative fatigue, where there's so many grants and so many projects and so many bills and so many it is a lot to juggle. Actually, our sheriff, Mike Reese, said to me, Abby, we got a lot going on. Can we just really talk about all of the stuff we're doing and make sure we're not duplicating services, we are not stepping on toes, and just really ensure we are doing all of this implementation work in the most effective way possible? And I thought, yes, Sheriff Reese, we can, and I'm going to use the sequential intercept map as a way to run that discussion.
We have some natural co-responders in our community that are able to assist and divert people. We have brought in our magistrates as a part of our CIT training to learn about how to intercept those in crisis from booking and into treatment. We are able to understand the purpose of mobile crisis, how the hospital is a support system, but there are also other avenues to divert people, such as our behavioral health urgent care.
So I would say that in Multnomah County, Oregon, in Portland, and surrounding areas, the SIM model not only was helpful for us to identify some gaps around individuals who struggle with mental health challenges, but also just as a facilitator of change, it is a great way to guide a conversation and to make sure that folks don't get too focused on something outside the scope of the conversation, but to really keep tangible goods in the same lane and to help us move forward in a tangible way.
Lastly, we'll be reconvening our participants and other community members that were not able to attend the first sequential intercept mapping to really collectively develop our work groups and drive some of the priorities home. Some of those priorities include increased coordination to crisis response, increased collaboration amongst supportive housing, and increased data sharing and collaboration, as well as identifying and appropriately serving those who are high utilizers or familiar faces in our system.
So hopefully that gives folks, I spent a lot of time describing the SIM model and the intercepts and that kind of thing. And hopefully that gives folks, an idea of how it can be used, as to guide discussion. Also, I really appreciated the woman towards the end of the video talking about how, next year we're going to have the same conversation with more people. So the idea is that this is a tool that can help not only kind of map the services that are available, but to return to, and, as the other woman was mentioning, the conversation with the sheriff, are all of the resources on here? Where's their duplication? Where's their gaps? And that kind of thing. So, yeah. So the next slide that we're gonna show is from the Policy Research Associates, PRA. PRA is the organization that formally conducts the SIM workshops. And so here is a list of California counties that have gone through the full SIM workshop process with PRA. We put the little map on there as a visual cue. If you all want to, after the presentation, click on that link that's at the bottom of the county list. You can take a look and see, who's done SIMs in your area and that kind of thing. You'll also notice that the list of counties and the years indicates when this was first completed, right? And clearly, hopefully most of these counties, if not all these counties, have returned to them over the years, right? It's not just a once in a decade kind of exercise, right? It's a tool that needs to remain updated. And so I think we have a couple polling questions about the SIM model and this map in particular. This first question, go ahead and respond when you're able. Looking at this slide, do you feel surprised? Do you feel surprised that your county is on the list? Do you feel surprised that your county was not on the list? Or, maybe you're not surprised because you knew, whether or not your county had completed a SIM workshop. Responses coming in. So looks like most of the folks indicate that they're not surprised that their county is either on the list or not on the list. And about a third of the respondents are saying that they're surprised they didn't know that their county had a SIM. This isn't that surprising. We know that counties, as smooth as we try to make relationships and communication, we know that, silos build up, often inadvertently. And so we encourage those of you who see your county on this list, we encourage you, if you're able, to try to, nose around and figure out who was at the table for the SIM that was done for your county. Where is the SIM? I believe you can access your county's SIM through the PRA website. Is that correct, Ande?
We're collecting the contact information for each of the folks that we can share out at our next session or prior to our next session. The map gains access to the locations, but not specifically the contact information yet.
Cool. So yeah, so I'll emphasize again, do some snooping around and see if you can figure out where the map lives, who's holding it, and take a look. The next polling question follows on the heels. If your county has completed a SIM, do you know who to contact about it? All right. So far, it looks about well over half are not sure who to contact about that. Please do some asking on your own, but as Ande shared, we're trying to get a hold of contact folks as well. So, if you get down the road a little bit and are still hitting a roadblock, please feel free to reach out. We'd be happy to share any information that we have on our end as well. So this is another list that we put together. We know that other counties have engaged at least in some level of SIM mapping. This is a list of counties who engaged in some kind of SIM mapping through an organization other than the PAR, who does the formal workshops. So this is a list, but with a little bit of a question mark in the sense that we don't know if they went through the full workshop, if they have a completed SIM and that kind of thing. So if you see your county on this list, please feel free to, also do some digging on your county level.
So right now what we want to do is we want to talk about some examples, or we're going to share one example from San Diego County. And I strolled through our attendee list and I don't see our San Diego folks on. I'm hoping maybe they logged on a little bit late, but we did have a few registrants. And if you're here, we just want to say congratulations. So our next slide is going to show you what the outcome for a sequential intercept model may look like. And I will say that this particular example out of San Diego has taken, I'm sure, a huge coordinated effort and many years of working towards this goal. So taking that into consideration, what we wanted to do was share how San Diego made their map information accessible to their community. In 2021, this last year, they launched their online SIM map using a tool, which was an eco visualization toolkit for civic mapping. So they converged the content with a tool, an online tool, to create this civic mapping. So what you see here is a comprehensive design that is their adapted SIM map. You'll notice that, for example, Dr. Soto mentioned that there was a whole group of people that were left off of the original SIM design. And when you were looking at the intercepts here, they have evolved their map to include 7 sequential intercept points or filters where people can be diverted from the traditional criminal justice system. So this is one example that shows the flow of services through 7 intercepts, as well as there's a little key at the top that shows how these services are integrated and intersect with each other. Another tool called an Airtable, and they created intercept cards. So what they've done is they've created a resource database that people can log into, and they can click on the different intercept cards, and the information becomes available how to contact that particular service or program. So I know when I was working in the courts, a tool like this would have been super resourceful, even live in court, to be able to pull up a resource immediately and share it with either attorneys or the participants themselves. So this was one way we wanted to show you that a county has taken it upon themselves to create the information in a way that is accessible for people. And we just wanted to share that out. So if you're here, San Diego, congratulations, good job. So the first one that you have here is a resource link to the SAMHSA GAINS Center, and GAINS is an acronym for Gather, Assess, Integrate, Network, and Stimulate. And this is out of SAMHSA. This website is a great starting point and a hub for information related to justice diversion resources. So we wanted to make sure you had that as like a great starting point. Next, the second resource that we have listed here are tip sheets. And this actually came up in a call we had recently, where we're seeing a lot of turnover with stakeholders and partners in our services. And somebody had mentioned it would be great if we had a resource that we could help guide and train and onboard new people. So we were super happy to hear that question asked in the recent call. And then to think about, we have this resource that's available. So what you have here are a list of tip sheets that link you to specific roles for stakeholders. So you've got judges, magistrates, county commissioners, DAs, public defenders, sheriffs, probation, parole, police chiefs, trial court administrators, and each of those walks you through what is their role, how do they interact with the different court systems and things. So that's just something we thought was really useful, and we're glad that we were able to connect you with that information. The link here at the bottom is the YouTube channel for SAMHSA. And that has over 60 webinars on justice diversion topics. And they're all listed out and categorized in the spreadsheet or the sheet that we sent out to you. So there's some little tidbits on an overview of what you have available to you, but it's 60, and all of these are no cost resources that are available to you at a time that works. So if you have new staff coming on board, these are things that you can provide to them and they can overview as they're not only learning, but also growing in their roles and adapting to the circumstances that we all face, like COVID. One of those resources is COVID specific. How do we adapt our settings to meet the needs now that exist because of COVID? Things like that. Are links that are included in the handouts that we provided. The first link offers project overviews and features resources that are related to the criminal justice system. And specifically, we pulled out the one that is related to the sequential intercept model because that's the item that we were really focusing on this afternoon. So you have links to different resources that are available there, and the archive provides how different counties have integrated these services, programs, and the SIM model map into their communities. So you have that. And lastly, we're sharing a resource provided by the Council of State Government Justice Center. This is a link specifically built for judges and psychiatrists working in justice diversion through their leadership initiative, the JPLI, that's their leadership initiative. The website offers training resources that supports these key stakeholders to improve judicial, community, and systemic responses to working with people that have behavioral health needs that are coming into contact with our justice system. So we have that resource that is role specific as well available.
Thank you, Ande. So we're moving into our sharing portion. So we have some polling questions. We also have a few discussion questions that we invite you to, when the time comes, to unmute and share verbally or to continue sharing in the chat, whichever you're most comfortable doing.
For Mendocino County AOT, one of the greatest strengths is we have a really good judge that understands the clients. She's also the LPS judge, so that helps. And our public defender is also really understanding. So we work really well together. I think one of the barriers is we've had some issues with law enforcement lately and not responding to certain situations unless it's like someone's in absolute danger of hurting someone else, they won't respond. So that's something that's being worked on. So we'll see where it goes.
Yeah, one of our challenges, so we have in Santa Cruz County, we have track 1 and track 2 diversion. Track 2 is for our incompetent to stand trial state hospital bound. We have evaluated several of those people, and our diversion specialist deems them very appropriate for mental health diversion, but due to their crimes and the concerns from the DA about community safety risk and not having the probation oversight, they are continuing to object to the request for mental health diversion. So we've had a lot of challenges with working with the DA and getting people on diversion.
This is
Thank you for-
Amanda. That's basically my same experience. Our DA and our public defender are reluctant to allow anyone who's been found IST to be diverted, even when the treatment provider and the county are saying they would be appropriate. They're very wary of anyone who would be a higher risk for, their criminogenic needs or their mental health. And we work very hard as a county to have the service line available, but we can't even utilize it because we're not getting the appropriate referrals. we frequently say we feel like we speak a different language because sometimes we will tell the judge, this person would be appropriate for just traditional outpatient, but they demand FSP, they demand like the highest level of care. And even though the research, doesn't indicate, it contraindicates that, like, the person would be higher likelihood to recidivize if they're given the inappropriate level of care. So we're just still having a lot of communication issues. And then of course, no housing, no funding. So that's kind of where Fresno is at.
Thank you for that comment. It's reminding me a really great suggestion that Linda Boyd brought up yesterday from LA County on the quarterly AOT call, was suggestion that we provide some TA specifically for judges, and to be able to bring them together can be really helpful to share some of this information. I'm hearing you, Amanda, saying that you've got the research behind you, you've got the programs that are available, and how challenging if that referral just isn't made, or if that pathway is not in practice available. Thank you for that point as well. Every Wednesday morning from 9 to 10 a.m. Pacific Standard Time it's called the 988 Jam. And it is a call for an hour where there's a short presentation from somebody who works along crisis continuum of care, justice diversion, or who is part of the work to create an alternative to 911. This presentation is not only phenomenal because it's kind of like what's really happening right now. Today's conversation was talking about the connection between 911 and crisis lines and how they need to be in communication with one another, as well as mobile crisis units and ride-along programs and other types of responding programs that, if we think about justice diversion on one side and these non-justice related crisis response on the other side, that part of what needs to happen is that communication between the two. Really exciting though about these weekly 988 Jam sessions is that they also have somebody who presents on legislative updates at a federal level and a state level. So it's a really good place to get information about, thank you, Ayanna, putting it there in the chat for us. Really great information, to a place to learn about upcoming funding sources and track legislation. It's going through the legislative process. Just this morning, they were talking about, for example, that at the end of the month, SAMHSA is going to be releasing another large money source that will be going to the state, eventually to trickle down to the county, again, related to 988 rollouts. So that's a great resource to share. I'll do another great shout out for the quarterly AOT calls for folks who are here. I know that's a place where counties are sharing information at an AOT level, which a few slides back, I think that we had talked about it at Intercept 4, 5, and 6, but frankly, I think could also be at earlier stages in the Intercept model as well. So that's another great place to share information. The CARE TA Center has an asset map. I mentioned this before. I wonder if we might be able to pull it up and show it to people. This asset map is a place to go, especially if you're newer. We saw in the beginning that many people said that they are newer to the work of justice diversion locally. So you may not know about all of the resources that are available in your county and in the counties that are immediately adjacent to you. So if you go to the CARE website, you can go to our asset map and very quickly search to see, here it is. Thank you, Ayanna, for that. You can very quickly search to see what are the crisis care and justice diversion programs that are available in your county and the counties right next to yours. So this information really is coming from the MHS OAC Transparency Suite. And there is a little bit of a lag time in some of the data, but it's a great place to go to say like, oh, do we have a mobile crisis unit? Do we have events that are activities or programs that are at the different intercept points? And wink, wink, nudge, nudge, this directly ties into our quote unquote homework assignment. So this is a great place to go to find some of this information if you don't happen to know it off the top of your head. If you do go to this website, this webpage, and you find that there are programs that your county has available that are not represented here, please do let us know. If you go down to the bottom of this page, there's a link that you can click on to add additional information or to edit any of the information that we have available. the information that we've used to populate this map was not sent to the state for the reason of this map. So it might be that you're going to want to adjust a little bit of the language that we use. You'll see if Ayanna were kindly to move the cursor to the right just a little bit in the map itself, that there we have contact people and contact phone numbers and websites that are available. So this is a great, again, resource to find out not only, oh my gosh, it turns out that we have, for example, a brief psychiatric stabilization unit. We could be encouraging our law enforcement to send people there at that intercept 0 point. Well, here's a contact name and person that I can connect for a warm handoff, essentially. Importantly, we really want to invite all of you to request training and technical assistance from us. All of our TA is provided at no cost. Thank you, MHSA and Department of Healthcare Services. If you were to go to our website and submit a TA form, which takes just a minute or two, you might well be paired with somebody brilliant like Dr. Soto or Ande Peña or any number of our partner agencies. We would love to work with you directly and appreciate hearing from you what it is that you need. For example, it could be that you'll say, you know, I'd really like to know what does the research say about this one particular topic. I'm about to go and advocate for a change in my county. We can provide you with that kind of literature. Or you might ask us for an actual training or consultation as you're doing some kind of system redesign locally. All of that, we would welcome an invitation to meet with you directly. So without further ado, I want to say again, thank you to my colleagues, Dr. Soto and Ande Peña, and to all of you for being here today. Thank you for the work that you're doing. We hope you'll stay in contact with us by visiting our website, send us an email, drop us a phone call, and connect with us, please, on social media. This is a great place, in addition to our newsletter, to stay up to date on upcoming events and resources as they are coming along.